Well, when you think of virtual reality, you often think of gaming, perhaps, but it is more and more often being used in medical training. Joining us to talk about how is Dr. Sabrina Fabi. Dr. Fabi, great to see you.
Nice to see you, Jen.
All right, let's talk about virtual reality, augmented reality, and how this plays a role in training doctors like yourself, perhaps.
Right, so I mean, commonly this is something that we've seen in the gaming industry, basically video games. And so now what we're starting to see is using this application to train doctors. Because ultimately, when we're learning, we're really learning on live human people with, families and children. And those aren't always optimal conditions. And so the thought is that if we can use this virtual reality to help train medical students as well as residents how to do anything from operating on the brain to doing an endoscopy, or even recognizing a stroke and kind of going through a diagnostic criteria to actually diagnose it, maybe we can save lives better and more effectively.
Yeah, and I got to imagine that there's a cost savings involved here as well.
Yeah, so medical schools worldwide, actually nationwide, spend about $500,000 on mannequins every year. And they spend tens of thousands of dollars on cadavers, which can only really be used and cut once. And so the thought here is that we'd be saving at least $1 million a year per medical school if you cut down mannequins as well as cadavers and use these holograms essentially with these specific goggles that allow you to visualize all of these different circumstances so that you can better diagnose and perform the surgeries that they're trying to train and teach.
Yeah, Dr. Fabi, you're not old by any stretch of the imagination, but I'm assuming you didn't really have this virtual training when you went through medical school. Could you talk about how maybe that could have benefited you, and maybe do you think there'd be any downsides, the fact that it's all virtual and you're not getting as much hands-on training?
That's a really, really good point. So during training, we did have actors that would assume a role and be suffering either maybe a heart attack or a stroke, and we'd have to kind of go through it with them. And so we did get that feedback on a human level, which I think is definitely not replaceable by some type of hologram by any means. But I do think that it could maybe be additive and help, in addition to what we already experienced in medical school, by being able to maybe give us some different types of feedbacks. And if you, let's say you were in San Diego, but you really wanted to take the course at someone at NYU, that NYU professor can kind of walk you through a surgery that's only being performed there so that you don't necessarily have to fly out and see that case, which you can never really control when a particular case is going to be coming in, right? You're relying that somebody's going to have that particular disease or issue. So this would allow you to be able to have access to a greater variety of cases so that you can be better prepared.
You're also even seeing doctors use it to talk with their patients, as you mentioned, from one coast to the other. You're having such access because of technology. Dr. Fabi, always great to have you. Wonderful to see you. Thank you so much.
Thanks for having me, Jen. Nice seeing you.